In this video, we will talk about 4 steps for the interpretation of a shoulder X-rays. So starting with the step 1. So in step 1, we assess the bones of the shoulder. So we trace the edges of the bones looking for cracks. So as you can see in this anterior-posterior shoulder X-rays, we start by tracing the edges of the bones. So starting with the humerus bone, we trace the edges looking for cracks. And as we can see here, the humerus is normal. There's no cracks in it. Then after the humerus comes the clavicle bone. We also trace the edges of the clavicle looking for any cracks. After that comes the glenoid. So this is here is the glenoid. We trace the edges of the glenoid looking for any cracks, and there is no cracks here. Then we move on to the spine of the scapula, which is here. We trace the edges of the spine, and after that is the acromion process. So this is here the acromion, and both the spine and the acromion have no cracks. And then we assess the coracoid process, which is this process here that you can see, and it has no fractures too. And then we assess the edges of the scapula, which start from the spine of the scapula and comes medially to the medial border of the scapula here. And we go downward, and then the inferior angle, and then the lateral border of the scapula here, and it ends to the glenoid. And lastly, we look over the subscapular fossa, which is between the edges of the scapula here, and we make sure that it has no fractures too. Now, if you see the fracture first on the X-rays, then assess the fracture and then look elsewhere, checking the other bones looking for fractures. Now also in step 1, which is assessment of bones, we also look at the general appearance of the bone, looking for decrease or increase in the density of the bone. Decrease in the density is osteopenia, and increase in the density is osteosclerosis. We also look for abnormal trabeculation, like for example in Paget's disease. So as you can see in this picture here, we make sure that the density of the bone is similar all over the bones. And a decrease in the bone density in the greater tuberosity of the humerus is normal. So as you can see here in the greater tuberosity of the humerus, it has lesser density than the other parts of the head, and that is normal. Now after step 1 comes step 2, which is assessment of the joints. So in assessment of the joints, we assess the glenohumeral joint, the acromioclavicular joint, and the sternoclavicular joint. So this is here is the glenohumeral joint, this is here is the AC joint, and this is here is the SC joint. And we look for the shape of the joint and the congruity of the bone ends, and we look for narrowing or asymmetry in the joint space. So we start with the glenohumeral joint, and there is an overlap between the humeral head and the glenoid, with the articular surfaces almost replicating each other's. So in the glenohumeral joint, as you can see in this AB shoulder X-rays, so you can see that the humeral head and the glenoid here are both articulating with each other, and their articular surfaces almost replicating each other. So this is here the humeral head articular surface, and this is here the glenoid articular surface. So when you see this overlap, this means that the glenohumeral joint is congruent and normal. Now moving on to the acromioclavicular joint. So in the acromioclavicular joint, we make sure that the inferior edge of the clavicle bone and the inferior edge of the acromion should be leveled. So they should be on the same line on the clavicle anterior-posterior view with 20 degrees cephalic tilt. So in this picture here, we have an AP clavicle with a 20 degree cephalic tilt. And as we can see here, the inferior edges of the acromion and the clavicle, they are on the same level. But if we have just an AP without cephalic tilt, then the inferior edge of the clavicle will be lower than the inferior edge of the acromion. Now, it's okay if the superior edges don't match up. So the superior edges of the acromion and the clavicle, they don't match up. They are on a different levels, and that is normal. And the joint space should be uniform, and the joint distance is less than 8 millimeters, and the normal is from 5 to 8 millimeters. So you make sure that the joint space is uniform all over the joint. Now also in the AC joint, the normal coracoclavicular distance is between 11 and 13 millimeters, and there should be no greater than 5 millimeters difference between right and left. So the coracoclavicular distance that you can see right here should be between 11 and 13 millimeters. Now regarding the SC joint, the sternoclavicular joint, it also should be checked if you can see it in the AP shoulder x-rays. So on this AP shoulder x-ray here, we can see the SC joint, and we make sure that this joint is not dislocated. Moving on to step 3. So in step 3, we assess the soft tissues. Now soft tissues refer to all the soft tissues except for the lungs, because we are going to assess the lungs separately in step 4. And in assessment of soft tissues, we look for changes in the density of the soft tissue, and we also look for abnormal bulges or any obvious secondary signs of trauma. And higher density soft tissues are muscles, while lower density soft tissues are fats. So as we can see in this AB shoulders x-ray, we look for any changes in soft tissue density or any bulges. So starting from here, we can see that the muscles have a higher density while the fat here have lower density. And as we can see in the supraclavicular region here, we have lines of fat that is splitting the muscles here of the supraclavicular region. And we also look in the axilla for any changes in soft tissue density. Moving on to step 4. So in step 4, we assess the ribs and we assess the lungs. So we check the ribs looking for any fractures, and we check the lung fields. We make sure they reach the rib cage and there is no pneumothorax, because many cases come with shoulder pain, and when you image them, you will find out that they have a pneumothorax and they don't have anything wrong with their shoulder joint. So as we can see in this AB shoulders x-ray, we trace the ribs looking for any cracks. So starting with the first rib, then moving on to the second rib and the third rib, and so on. And we also make sure that the lung markings are reaching the edge of the rib cage, so there is no pneumothorax. And as we can see in this x-rays, that the lung tissues are reaching the edge of the rib cage, meaning that there is no pneumothorax in this patient. Now, in the explanation earlier, we talked about applying these steps on the anterior-posterior shoulders x-rays. Now let's talk about applying them on the lateral shoulder x-rays. Now, the same 4 steps applies to the lateral shoulders x-rays. So we start with the step 1, which is assessment of the bones. So we trace the shoulder bones looking for any cracks. So starting with the humerus here, we make sure that there is no cracks on the humerus. Then we move on to the glenoid of the scapula, looking for any fractures. Then we look into the coracoid here and the acromion, looking for any cracks. Then we move on to the spine of the scapula here, and then we look into the scapula body here, looking for any cracks. And finally, we look into the clavicle here. As we can see, it all look normal. Then we assess the joints. So starting with the glenohumeral joint, we make sure that the humeral head is sitting in the center of the glenoid, and this is here a normal glenohumeral joint. Then we move on to the AC joint. We make sure that the acromion and the clavicle on the same line, so this is a normal AC joint, and the ST joint, it can't be seen here. Then after that we move on to step 3, which is assessment of the soft tissues. So we make sure that there is no changes in the density of the soft tissue and no bulges, and here the soft tissue is all normal. Moving on to the final step, we make sure that there is no cracks in the ribs, so we trace them all looking for any cracks, and we make sure that the lung field reaches the edge of the rib cage, so there is no pneumothorax, and the ribs and the lung field here all normal. Also in the lateral shoulder x-ray, the coracoid process always pointing anteriorly, so as we can see here, the coracoid process is pointing to this side, meaning this is the anterior of the x-rays, and the humerus is sitting in the middle of the glenoid, as we explained, and the lung field are going to the edges of the rib cage. Now let's apply these steps to the axial shoulder x-rays. So this is here an axial shoulder x-rays, and we also start with the first step, which is assessment of the bones. We make sure that the humerus has no cracks. Then we move on to the glenoid. We make sure that it has no cracks, the glenoid neck too, and what we can see from the scapula, we make sure that it has no cracks. The coracoid also here, and the acromion and the clavicle. Assessment of the joints. So starting with the glenohumeral joint, and as we can see, the humeral head is sitting in the glenoid, and the glenohumeral joint is congruent. And we have the AC joint here, and as we can see that the acromion and the clavicle are on the same line, meaning the AC joint is normal. And then we check the soft tissues. In step 3, we make sure that the soft tissues are normal, which are normal in this x-rays. And we finally check the ribs here, and we check that the lung markings are reaching the edge of the rib cage, which are all normal on this x-rays. Now, the axial shoulder x-rays are not easy to obtain on trauma patient because the patient has to mobilize their arm for the picture to be taken, so it's painful to be taken, and the same 4 steps applies to the axial shoulder x-rays as we explained. Now, the coracoid is always pointing anteriorly, so this is here is the coracoid, meaning this is the anterior part of the x-rays, and we make sure that the humeral head is sitting in the glenoid. Now let's talk about the imaging series. So if we have a shoulder trauma, we order a shoulder series which consists of an AP, anterior-posterior, and lateral, and plus minus an axial shoulder x-rays. If we have a clavicle trauma, we order a clavicle series, which is an AP and axial. If we have a sternoclavicular joint trauma, we order the SC joint series, which is an AP and an axial. And finally, we have the AC joint series, which is not done unless it's a confirmed injury, and the AC joint is mostly evaluated by using the clavicle x-rays or the AP shoulder x-rays. And the AC joint series is an AP plus minus an axial. Now it is important to talk about the sternoclavicular joint x-rays because it is a little bit different. So the SC joint require an AP and axial to be evaluated, and it also require knowing the symptomatic side by asking the patient which SC joint is hurting them, so it is either right or left. And when we have the x-rays, we draw a line between the midclavicular plane for both views so we can appreciate the displacement, and the axial is very helpful in looking for displacement. So this x-ray here is an axial SC joint x-rays, and it is for a 24 years old person who dislocated their SC joint before 1 year. So as we mentioned, we draw a line in the midclavicular plane like that. And as we can see that the clavicle on this side is dislocated and there is osteoarthritic changes on the end of the clavicle. Now let's talk about some injury X-rays examples. So on this picture here, we have an X-ray of an AP clavicle, and then we apply our steps. So starting with the step 1, which is assessment of the bones. So we assess the humerus, looking for any fractures. Then we assess the clavicle. So as we can see here, we have a clavicle middle third fracture. It's a comminuted fracture that we can see here. And we move on to the end of the clavicle, and we can see that it is normal. And then we assess the scapula. So we have the glenoid here. It looks normal. The coracoid, the spine of the scapula, the acromion, and the rest of the scapula, it has no fractures. And then comes step 2, which is assessment of the joints. So as we can see that there is the nice overlap between the humeral head and the glenoid here. This means that we have a normal glenohumeral joint. And we also can see that the inferior edges of the clavicle and the acromion are both on the same line, but the joint space is a little bit wider. And regarding the SC joint, there is nothing significant here. And then we move on to the soft tissues. We can see that on the injury site that there is a bulge starting to form here. But other than that, the soft tissues are normal. And then we check the ribs, looking for any fractures. And we also check the lungs here. And as we can see that the lung is reaching the edge of the rib cage, meaning the lungs are normal. So in summary, this is an AP clavicle with a middle third clavicle comminuted fracture and some soft tissue swelling. Moving on to the next injury here. So as we can see that we have an AP clavicle that you can see right here for this patient. And this patient left shoulder is dropping. As you can see, identified by this line, so the right shoulder is higher than the left shoulder, meaning there is some problem with the left shoulder. And if we assess the X-ray, we start with the bones. So starting with the humerus here, we can see that the humerus is normal, the clavicle is normal, but the glenoid is fixated due to some type of fracture before. And then the coracoid, the acromion, and the scapula all look normal. Step 2 is for assessment of the joints. So the glenohumeral joint is not very well seen here. But when we move on to the AC joint, we can see that there is some type of problem in the AC joint here. So we can see that the inferior edge of the clavicle doesn't match up with the inferior edge of the acromion here. In fact, the inferior edge of the clavicle is above the superior edge of the acromion. And this indicates a type 3 AC joint injury on the Rockwood classification. And then we check the soft tissues and we can see that we have a bulge here, but other than that, it's normal. And finally, we check the ribs and the lungs and both look normal here. Moving on to the next injury here. So we have a Gray-Shee view of the shoulder joint here and the same steps applied. So we start with the bones. So the humerus is normal. The glenoid is normal here. The clavicle is normal. The acromion is normal. The spine of the scapula is normal, but the coracoid here is fractured. So this is a part of the coracoid and this is the other part here. So we can see that the coracoid process is fractured and displaced here. We also check the joints. So we can see that the shoulder joint is congruent and we can see that the AC joint is also congruent and normal. Moving on to the soft tissues, they all normal and we can't see any ribs or lungs in this picture here. So on summary, this is a Gray-Shee view showing a coracoid process fracture of the shoulder joint. Moving on to the next injury here. So we have an AP shoulder X-rays and the same steps are applied. So we start with the bones, looking for any cracks. We start with the humerus here. It's normal. Then we move on to the clavicle and we can see that we have a clavicle middle third fracture here with displacement. And then we move on to the glenoid. We can see that the glenoid is normal, but when we move on to the glenoid neck, we find that we have a fracture here and we have a displaced fragment here. Then we check the scapula spine and the acromion, both are normal, and we check the rest of the scapula looking for any fractures, and it's all normal. Now in step 2 we assess the joints. So the glenohumeral joint here is normal, the AC joint is normal, the SC joint is normal also. Now in step 3 we assess the soft tissues, and we can see that we have a bulge forming here, but other than that the soft tissues are normal. And in step 4 we check the ribs looking for any fracture, and we can see that in the first rib we have a fracture here, and we check the rest of the ribs looking for any fractures. And also in step 4 we check the lungs, making sure that they reach the edge of the rib cage, and we can see that the lungs are reaching the edge of the rib cage. Now this line that you can see right here is an artifact, or it's the patient claudius, because the lung markings are reaching beyond this line, meaning that there is no pneumothorax and the lungs are reaching the edge of the rib cage. Now here we have an AP and lateral shoulder x-rays of a patient with recurrent shoulder dislocations, and we apply the same steps. We can see that the humerus is normal, the clavicle here is normal, the acromion, the spine of the scapula, and the glenoid all normal. Step 2 is of the joints, and we can see that the glenohumeral joint is dislocated here. So on the AP view, we can see that the humeral head is displaced inferiorly, and on the lateral, we can see that the humeral head is displaced anteriorly and inferiorly, meaning this is an anterior shoulder dislocation. We also check the AC joint. We can see that the AC joint is normal in both views. And we also check the soft tissues looking for any swelling. And finally, we check the ribs. So the ribs here are normal, and the lung markings are reaching the edge of the rib cage, meaning that there is no pneumothorax. So in summary, this is an AP and lateral shoulder x-ray of an anterior shoulder dislocation. Now this x-ray is an AP shoulder x-ray of the same patient after the shoulder has been reduced. And we can see that we have a compression fracture on the posterior part of the humeral head here. And this is a Hill-Sachs lesion. It's a posterior compression fracture. It happens during the shoulder dislocation. And at the same time, we also have an inferior glenoid rim fracture. And this is called the bony Bankart lesion. It also occurs during the dislocation. Now moving on to the next injury. So on the left picture, we can see an AP shoulder x-ray of a patient with posterior shoulder dislocation. And on the right picture is an AP shoulder x-ray of a normal shoulder. So if we assess the x-ray of the shoulder with posterior dislocation, we can see that the glenohumeral joint is not congruent. This is here is the glenoid, and this is the humerus. We can see that the joint space is wide, and there is no congruency between the humeral head and the glenoid. While on the normal x-ray, we can see that there is a congruency and the joint space is normal. And also on the posterior shoulder dislocation x-ray, we can see that the humeral head is in the shape of a light bulb. This is what is called the light bulb sign. It's a sign for a posterior shoulder dislocation. And in assessing the left x-ray, we follow the same steps. Starting with the step 1, we assess the bones, looking for any cracks. And in the third step, we assess the soft tissues. And we can see that there is increasing density around the humeral head here. Besides that, there is nothing significant. In step 4, we check the ribs and the lungs, which doesn't show here. Now this x-ray is an AP shoulder x-ray of a patient with luxatio erecta, which is an inferior shoulder dislocation. So in inferior shoulder dislocation, the patient present with their arm abducted, and it is locked in abduction. They can't move it downward, and this is very indicative of an inferior shoulder dislocation. But we take the x-rays looking for any fractures or any injuries that would restrict us from doing the reduction maneuver. So we also apply the same 4 steps. So starting with step 1, looking for any fractures, and on this x-ray we have no fractures, all the bones are normal. Then we move on to the joints, and we can see that the glenohumeral joint is not congruent. It is displaced inferiorly and the humerus is abducted. So this is the glenoid here, this is the humeral head. They are away from each other and they are not congruent. But the AC joint is normal. And regarding the soft tissues, there is a swelling around the humeral head, but beside that there is nothing significant. And in step 4, the ribs shown here and the lung tissue is all normal. Now in the last x-ray here, we have an AP view of the proximal humerus, and we apply the same 4 steps. So we start looking for cracks in the humerus, and we can see that we have a fracture in the surgical neck of the humerus. So this is a 2-part surgical neck proximal humerus fracture. And we also check the glenoid looking for any fractures, and this is normal. And then we move on to the joints. We can see that the glenohumeral joint is normal here, and we can't see the other joints. So in summary, this is a 2-part surgical neck fracture of the proximal humerus. And with that, we reach the end of this video. Thank you guys for watching. Please give us a like and comment your ideas and questions. And this video is a part of a bigger class. It's called the Shoulder and Arm Trauma Masterclass. You can check it out if you want.